Returning to the pandemic, though, as the COVID situation continues across the nation, sending millions back into lockdown, experts are sounding the alarm over growing numbers of people suffering mental health implications linked to the pandemic. Joining me now is a psychiatrist, former Australian of the Year, Professor Pat McGorry. Pat, thanks so much for your time. As always, you and I have discussed this a number of times during the pandemic. How concerned are you now about this latest lockdown, given it's now affecting, 12 million Australians as we speak?
Yes, Kieran, I am pretty concerned. We've certainly seen in Victoria a rising tide of impact, especially on young people, with very high rates of deliberate self-harm presenting to emergency departments, eating disorders surging as well. We've seen this, and health department data really support that over the last year or so. How not specifically just linked to lockdowns, but to the disruption to their lives caused by the pandemic more generally, especially educational pathways and employment. And we know that the government's measures to kind of sustain those, especially employment, was very protective. Education's a different story. That's been pretty damaging, and we think there are going to be long-term effects of that disruption. In other states, they're probably new to repeated lockdowns, so they're probably starting to empathise a bit more with what we went through in Victoria last year. And I think people are getting very frustrated and getting tired as well, I would say, too.
Absolutely. I heard your Premier, Daniel Andrews, talking about the need to get to 70, 80% and then to start opening up. For all of these other reasons, Pat McGorry, it's incumbent upon us to start talking about that, if not for the health of our young ones.
Well, I think what I'm hearing from people, and not just people presenting in distress or with mental health problems, but just from wider colleagues and just the general community, is that the repeated lockdowns seem to be almost inevitable until we can get to that herd immunity sort of level, whether it's 70, 80, 90%, maybe it's even as high as 90%. I've been reading that with the more infectious strains. So that has to be the top national priority. And just listen to your program. The big problem is that the major supplies of Pfizer will not be appearing until later in the year. So AstraZeneca, which is a highly effective vaccine, is the only one that we really have. So how can we actually overcome this kind of lack of confidence now in AstraZeneca vaccine and get more people vaccinated? I noticed the numbers are quite high today, listening to Simon Birmingham, but that has to be the top national priority, to increase those rates as fast as possible, because otherwise there's no choice. I mean, you can't blame the premiers for locking down when there isn't an alternative. Indeed,
but the scenario, and we thankfully are not seeing stay-at-home orders in Victoria now. That's one blessing in all of this at the moment. Yes. There's some respite for your state, because as you've said, and you and I have discussed it many times, the impact on Victorians, particularly adolescents, has been, quite frankly, it's been too much. It's been enormous.
Yeah. And I think we've seen this pattern worldwide. The young people have borne the brunt in a practical sense, but also in a mental health sense. And governments, both federal and state, have actually responded to that. Most recently, we've seen the Victorian government add funding for Headspace centres, but from state government funding to deal with the surge of need and to reduce waiting lists. Federal government in the budget also added money for that purpose too. So governments are responsive, but I suppose it's above my pay grade, to be honest. I mean, this controversy about the vaccines and the rollout and all of that kind of stuff, but that to me is the thing that's prolonging the ordeal for people and meaning that lockdowns are occurring, and lockdowns are very cumulatively demoralising. I think that's the problem. One lockdown, maybe two, but when they're repeated and there's no end in sight, that's what people are really saying.
Is it that lingering sense of anxiety or dread? Is that what the cause is?
Yeah, I suppose it's like a loss of morale and hope that there's an end in sight, and especially when they see other countries starting to emerge and get back to a more normal life and living with COVID. And I suppose we've had this elimination strategy, which has been great while it's lasted, but we won't need to do that once everyone's vaccinated, because we can live with it, and that's what other countries are much closer to now, ironically, than we are. And that's what I think people are saying, and they just got to hang in there and until this is we get to that stage, and maybe it's only a few months away, but we're struggling to support people at the moment, and particularly the young people. It's having a cumulative effect, and governments are helping us to deal with it. I want to thank them for their support, both federal and state, but I really hope that the medical experts and the political leaders in the wider world, in the pandemic world, can actually work together effectively to get us through this more quickly.